Hey, I'm Steve Spencer. I'm the founder of the Birmingham Medical News, and this is our healthcare podcast. Today, we're going to be talking to Dr. Micah Howard from Huntsville, Alabama. He's an integrative medicine doctor, and he's going to be talking with us about anxiety. I want to let y'all know, too, that our partner in this podcast is Kassouf and Company. Kassouf started as a CPA firm over 90 years ago. Now they do full service accounting, wealth management, and they have a very strong healthcare consulting practice as well. Okay, our sponsor today is Integrative Therapeutics. They've been in business over 35 years providing supplements that are formulated by doctors. You can find their supplements at integrative medical clinics as well as a couple of select online retailers. I went to their website. It's integrativepro.com, and I was impressed. What stuck out to me, their broad range of products, and secondly, the quality. Now, regarding the range of products, they have supplements for pretty much anything health-wise that you'd like to optimize. For example, they've got supplements for cardiovascular health, for gastrointestinal health, for sleep and stress, for blood sugar metabolism, and that's just to name a few. In terms of the quality, these people are meticulous about what goes in their product. They test all the raw materials, and then anybody that wants to supply them, for suppliers, they have to go through an extensive sourcing program. And anybody that doesn't meet their sourcing qualifications is banned from being a vendor. Obviously, the next step in producing the product is manufacturing. And there they have a lot of third-party credentials. Just for example, for one, they are Good Manufacturing Practices certified. So I'm impressed with their product. It's good quality stuff, and I think you will be too. Introduce everybody. This is Dr. Micah Howard. He has actually the first accredited integrative medicine clinic in Alabama. It's in Decatur, Alabama. And one thing we want to thank Dr. Howard too for is that he's working hard, busy with patients, So we're actually recording this after hours, but we appreciate him being willing to do it after hours. So welcome, Dr. Howard, and let's what do you plan to talk about today?
Absolutely, thank you so much. It's proud to be connecting with you guys. A Birmingham upstart from UAB, graduating back there. But I've kind of been around a bunch of different places and actually got that fellowship in integrative medicine from the Andrew Weil Center for Integrative Medicine there in Tucson, Arizona. So a lot of people are talking about integrative medicine, and it's becoming a big thing. But a lot of people don't know that there's actually a medical fellowship, so a postdoctoral doc that's people are doing there, and lots of good information. A way to take a lot of the things that we think about supplements and stuff, and actually blend them with medicine, as we call Western medicine. And I think sometimes people think it has to be either one way or the other, but we're learning that there are beautiful things coming from all sides.
But by the way, that really struck me. I didn't know that's where you went to Dr. Wheels. I'm familiar. I've read a couple of his books.
Yep.
Tell me a little bit before we get started about what it was like out there and what the program was like.
Absolutely. So I've worked with Dr. Weil since.
I'm sorry.
So no problems. Dr. Andrew Weil is the pretty much the founder of integrative medicine, starting in Harvard botany and doing a lot of the basic studies. Got books from all the way back from late 60s and such, documenting some things. But he started this program, if I'm not mistaken, about 6-7 years ago officially. So the residency has been about between 3 and 5 years. And so I started working with Dr. Weil through the Arizona School in Tucson about my middle year at UAB. So in between my second and third year, I got to do integrative medicine rotation, where we learned about, traditional Chinese medicine, Ayurvedic medicine in India and such. And then I just kept up with them and that group as they were building. And when they finally made a fellowship and got it approved for the American Board of Physician Specialties. So we became official. So everybody was like, all right, so let's do this. So it's really one of the major specialties that's come along since family medicine in the 50s. So
That's really great. Like I said, I read one of his books probably 20 years ago, and
yeah,
I know he's, like you said, pretty much the founder, and
yep,
that's really interesting because I know a lot of that too. All the things he does is pretty much evidence based, which is great.
yes. And I think that's where a lot of the schism is. So a lot of times people say if it's supplements or botanicals or traditional medicines, then there's no evidence. You'd be
Mhm.
surprised. You'd be surprised. And one of the main tenets of integrative medicine, which I think resonates with people in general, is that there are tons of things that have maybe a small benefit, but no risk.
Mhm.
And so in
Mhm.
a world like today, don't we want just as many of those as possible? So I'll take everything with a little benefit and no risk. Um,
Absolutely, yeah.
so things that come to mind are things like acupuncture, yoga, etc. You're
Mhm.
never going to harm yourself with those things, but there's an opportunity to have some benefits. So I think now we've kind of come full circle to what I call an ancient modernism. So
Mhm.
we're
Mhm.
taking some of those old understandings and sort of applying them in a modern world, and we're still humans, so they still fit.
Interesting, interesting. Well, I guess we should go into, well, before we get to your topic, you mentioned yoga, and I've never, well, I think I've tried yoga like once. Does yoga have health benefits? I guess it does, but how? I mean, or not how, but like, what do you find from that?
So not only does yoga have some pretty incredible health benefits, but there's a lot of data on yoga.
Oh,
So
interesting.
it was the late 60s whenever Yogananda came over. So there's a group called Shivananda Yoga.
Okay.
And one of the guys they sent from India to the California area, and it kind of that's where things became popular. But
Mhm.
since then, we've actually collected a lot of empirical data from it, and a lot
Mhm.
of different. One of the beautiful things is you can kind of tailor it in. So
Okay.
I'll jump ahead and say there's a pose that's called shoulder stand. So
Okay.
in essence, what you're doing is you're kind of doing a balancing with your head on the ground, the back of your neck on the ground, and your feet up. So you're
Okay.
laying flat on your back and you raise your feet all the way
Okay.
up to where you're standing kind of on the back of your neck and your shoulders. Now, what that does in pressing the neck toward the chest
Mhm.
can limit a little bit of breathing. It affects the thyroid, but also it gives you that same feeling of anxiety where it's
Mm.
not as easy to breathe. And
Okay.
in yoga, they do a lot of that for people that have generalized anxiety disorder so that you can find calm in an otherwise stressful situation. So, finding one of these positions that may not feel comfortable can actually teach you that you can breathe, you can be calm, even though the world around you is quite stressful or doesn't seem to fit.
And I guess right there is a good point, time for us to stop and make sure everybody knows we're talking about anxiety today. So in getting started on that, um, uh, what actually is anxiety?
So I wanted to come through this topic mainly because I see a wide range of people. So as a family medicine base, we got kids all the way up into our geriatric population, and
Mhm.
no one's immune. No one's immune. I think this term has elevated over the past maybe decade and a half because of the level of stress that's in the world. But one of the things that I want to help understand as we have our 15 to 20-year olds coming through this world, it
Mhm.
seems to be like it's a disease without a behavior. Um, and
Okay.
I think we need to actually split those things apart, not to
Mhm.
give any sort of disrespect toward the disease or the suffering that occurs, but to also remind people that it is and always has been a method of behavior. So we bring the behavior
One
back
second,
into.
when you said it's a disease without a behavior, I didn't really understand what you meant.
So we can't see it that way. So sometimes in today's world, I get to interview people all the time, and they
Mhm.
often feel like they'll often say my anxiety or I have anxiety. Now these are
Okay.
common words, and they may be just root words just to say because
Mhm.
it's the way to talk, but
Mhm.
it means something a little deeper. So
And by the way, I think I understand when you said anxiety is a disease without a behavior. I thought a behavior is, a person behaving, but do you mean more as a medical, something you can observe? Is that what you mean? Say
more
behavior?
like it's there's some things like if you had a specific disease like lupus or something for say, There are habits that can lead you to having lupus, inflammatory issues and things, but in general, it's a disease. Lupus is a disease. Whereas anxiety, if it is a disease, it stems from behavior. So it's something we've done as much as it is a chemical process within the body.
Okay, I'm sorry, I got you off track, but go ahead.
No, it's no problem. I think what's happening in today's world, we're splitting it apart. And I think what we have to do, just in the basics of integrative medicine, is we have to put it together. There are chemicals, there are things that are going on in the mind, but they are affected by the behaviors that we have, and they may have originated from these things.
Okay.
So, in general, the word anxiety has a Latin definition and a Latin root that comes from the same word as anger. So it's ango, but that word in Latin really means to constrict. Okay. And there's a beautiful realm of thought in saying that anxiety is simply excitement holding its breath.
Okay.
So if you look at what people would express if they say, I feel anxious or I'm having anxiety, and you ask them to turn it into a behavior. So you say, so tell me what you feel. They'll say the same sort of things as if someone's excited. Their heart is beating fast. They're breathing a little faster. They may be shimmering or shaking or feeling flutters in their belly, all of those things.
Okay. Okay.
One of my main goals when I talk to patients who are experiencing this outcome of thoughts, feelings, and behavior is let's break it down. Let's make it fluttering. Let's make it feeling like I'm going to break out into sweat, because I don't think that the word anxiety gives us anything to hold on to. And as many people talk about, if I were to say, I have anxiety, and you were to say, you have anxiety, we may agree in that fact, but it may be two completely different things.
Right, exactly. I mean, they may be different intensity, that we may have different feelings. One
Absolutely.
of us breath, the other one may have fast heart.
Absolutely. And oftentimes I'll express something to patients. So my goal is to help the patient kind of look inward at it, to take this presupposition of anxiety and turn it into something we can actually do something about.
Okay. Okay.
And so
go ahead. You go ahead.
No, you go ahead.
Well, I was just going to ask, once you've done that, and I think you were probably going there anyway, is what does the patient learn to do about it? And maybe you were going that way anyway.
So absolutely. There's a common scientific principle that when you study something, you actually change the thing you're studying.
Okay.
So Bernoulli's exclusion principle. You end up seeing something and you say, okay, I'm going to look at it and I'm going to focus on it. And the more you focus, you actually change the thing that you're looking at. So
isn't it the Heiser? What is it?
So there's Heisenberg uncertainty principle,
right.
And then Pauli's exclusion principle. I'm sorry.
Okay.
But those things, we affect the system whenever we look at it. So if you take somebody with anxiety and you ask them to take it apart, just to look at it, by definition, it changes. By the end of this conversation, I'm going to give you a sentence that explains anxiety in a way that is so easy to understand that you can't unlearn it. I use the word presupposition, so it turns anxiety, which is a word like freedom. You can't do anything. You can't put freedom in your pocket,
Right.
But anxiety is not really a word like that. It's really a series of habits, behaviors, all of these things that, end up in chemical sort of changes. But by the end of this conversation, I'm going to give you that sentence. I'm going to build a little anticipation now, but I'm going to give it to you because I found that when you do look at it, it really makes a lot of sense. Once you know what you're doing, the beginning of like changing begins there. So I'll often make an example to people. So imagine yourself, you're a 14, 15-year-old girl or boy, and you're knocking on the door of your love interest's family, and you don't know it's going to be their mother, their father, whatever. You may even have like a little flower behind your back.
And that anxiety, I know, man, it's pretty high at that point.
And so what feelings are you going to have? You could say anxiety if you want. You could also say excitement. If you said something like you were sweating, having heart palpitations, you were short of breath, Those are things leading toward a heart attack. Same sort of symptoms we described. But are you having a heart attack? Probably not. Are you excited? Probably. Do you have some level of anxiety? Yes. But you'll notice, like, all of these things are really just a way to communicate all of these physical feelings that are going on that are probably based on you thinking what is or is not about to happen.
Okay.
So whenever we get the old words anxiety, and when we get this kaleidoscopic manifestation of all these different things, what we end up finding is that it's often related to constriction. So we get really tight in our breathing, in our throat, all of those things. And it's usually based on, hello, friend. It's usually based on us having an experience about something we're going to do, or it's going to occur, that we don't want to occur. Okay. So this definition kind of is a smart thing to come into play here. Anxiety has a time-based.
Oh, it's okay.
I'll give a little reset. I'm so sorry.
We're both at home, so that's.
Oh yeah, that's how it happens. It's either at work or home. So anxiety, by definition, has to have time involved, and more often than not, it's the future.
Gotcha. Somebody told me once that is this correct that depression is more about the past, anxiety more about the future?
I really feel the more I see it and work with it, the more I feel that they're both the same coin, just opposite sides. So anxiety, you have to have some sort of future event in effort to be anxious. And it doesn't take a lot of understanding where people are like, okay, yeah, that does make sense. I never thought about it that way. But it's something you're doing in the moment, but you're kind of forecasting. And more often than not, if you're forecasting something good, it becomes excitement. If you're forecasting something you don't want, it becomes anxiety.
Right.
So the definition that I will sit and let people kind of chew on that really makes sense is anxiety is imagining something in the future that you don't want and acting as if it's already occurring.
Okay.
And what happens whenever you take that definition and you kind of apply it, it now has handles. So now it's something you can grab. It's no longer like freedom or those words that you can't put in a wheelbarrow, that you can't put in your pocket. So if I say that you're imagining something in your future that you don't want, let's say you have a really good imagination. You may be able to imagine it with full color, full sound, a smell, all of those things. Well, then the mind doesn't know which one of these is actually happening. So the second response is that it might prepare you for some horrible danger that you're sensing is coming. That's a natural process of what's going on.
By the way, and I don't want to get you off track too much.
No.
That just kind of hit me that I guess maybe it would stem from, early humans when we were hunter-gatherers, because, that future event was going to be going after that mastodon.
Absolutely.
And you sort of had to be, I guess, a little bit revved up or excited or you had to be intense to before that action. And I suppose in our life today, especially in a wealthy country like America, we're not experiencing those situations. So usually we don't need to be revved up and that intense. Would that make sense?
And or we have so many of these experiences perceived that we find ourselves completely overwhelmed and we never go down. We stay.
But it sounds to me like it's more about perception, because in early humans, it would be about reality, right? I mean, if you're not careful, that lion's going to eat you.
That's right.
And so you've got to be pretty tense and sort of on guard all the time. But it would seem to me, now in some parts of the world, life is still pretty scary. I mean, like in Haiti today. But in America, our life is by and large pretty easy. So it seems to me like, to some extent, we're getting revved up over things that our ancestors would have needed to be revved up about, and maybe we don't as much. So
I think it's absolutely true. I think it brings me kind of a little to a story. The Stoic philosophers of ancient Greece, particularly Epictetus, had this sort of discussion that said, why did they have a man versus lion in the Colosseum? And, people's responses would be like, we like brutality. We want to see this challenge. We're in essence not good people. We like to see the violence and such. But he said, no, that's not the truth. What happens is that a man versus lion is willing to be wagered upon. So you can bet on a man versus lion.
Okay.
Now, lion might win, the man might win. You might have a weak lion. You might have a really wise man that makes a tool. So it's a fight. And so you can bet on it. Now, he said, that being true, you'll never see two lions versus one man in the Colosseum.
Okay.
He said the reason why is it's lions every time.
Yeah, right, exactly.
I think in our world, particularly with this 15 to 22-year-old age group, they are perceiving lions far beyond their sphere.
Gotcha.
They don't even have a chance. So I interviewed someone here recently that said, I asked if they have any close friends, and they told me that they had over 1,000. Now, we know what 1,000 friends means as adults in sort of a 40-plus age group. But when I think about that, if you have a sample size of 1,000 humans, the amount of drama, the amount of like somebody's going to be sick, somebody's going to have lost their loved one, someone's going to have a car wreck, that's a lot. And even though these people aren't what we call friends, they still kind of experience them.
Yeah, because 1,000 friends is obviously your people on social media.
Exactly.
And there's so much drama in that. And of course, bullying is a big problem with that too. So I definitely believe that social media has led to an awful lot of difficulties and anxieties among teenagers and probably younger.
Absolutely. And so I think that hunter and gatherer out in the world looking for the lion would never think that there were 100 lions within the 1,000 miles around them. They're probably just going to be focused on that one lion, which actually gives them some chance. And that anxiety is a way to kind of make a couple of scenarios in the future of what could be done, what could happen. So you got exit plans, those things. Now, in today's world, we either don't have those true stressors, so we create them in our own mind, or we look for those stressors in the outside world. Even us talking about Haiti today, how many years ago would it have been to where we wouldn't have known specifically or even seen with our own eyes those sort of struggles?
Exactly. Less than 100 years ago. It's funny you say that, and I don't want to get you off the topic, but on those sort of lines, a few weeks ago, I was in my car and I had National Public Radio on, and they were talking about a conflict somewhere in the world. And it just dawned on me that second, I thought, what good is it doing me knowing about this? I can't do anything about that conflict. I can't make it better. And so it is interesting in some ways. We're inundated with news and we have to worry about conflicts all over the world.
Absolutely. When
actually we can't change them. It does nothing for us.
That's so true. And so people that are so my whole approach is that we will all deal with anxiety, but you don't necessarily have to suffer from anxiety. Okay. You've got to at least get your hands on some of these handleable topics. And often the earlier you get, there's always the metaphor of this sort of panic attack as a snowball rolling down the hill, getting larger and larger, and then you can't do anything about it. But with all of those situations, if you address them at the very early stages, that's when you have the biggest effect. So what we end up going from is learning a little bit about the conscious, unconscious mind and those things. I think that is a very important sort of thing to be understanding as far as anxiety is concerned. So I think one of the most important processes is the process that describes the mind's inability to process a negative. Okay. So when you have the word not, or you try to describe a not something, for instance, there is no cat. The brain, that's a linguistic term. Okay. But the brain, in effort for us to communicate, you have to make a cat and then you have to take it away.
Leading. Yeah.
Yes. And so, it's the when I talk about anxiety, I always bring across the point of, don't imagine a blue tree, or don't imagine a yellow cat playing with a purple ball of yarn in your grandmother's backyard.
Okay.
The brain can't do that in the
Mhm.
steps that you speak it.
Mhm.
Anxiety is similar. So if I say, don't have a panic attack,
Mhm.
the brain immediately has to search everything that's going on that will check off the list of panic attack and
Mhm.
check
Mhm.
those off. It can't just not panic attack. It has to say, what is a panic attack? Okay, it has this, this, and this. Well, I definitely have those. And these
And
are kind of the
it also
conversations.
makes the word panic attack is in your mind, even if the word don't is before. The word panic attack is still in your mind. It seems like
Absolutely.
better would be to say, be calm. It seems like.
Absolutely. So
Yeah.
that's
Anyway,
part of the strategy. The strategy I think that works the best, I call it turning your worries into prayers.
okay.
When we worry, it's a
Mhm.
mental process that everyone knows. It's literally anxiety on purpose. So you're like, oh my gosh, am I going to be able to pay this bill? Or, is my child going to come home safe? They're after their curfew, those sort of things.
Mhm.
But people often pray in the complete opposite direction. Give us grace, help them come home safe, all of those things.
Sure.
So
Right.
I try to tell people the difference between what you want and what you don't want is the
Mhm.
key to controlling anxiety in its very first steps.
Okay.
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 So as soon as you can realize that you're doing this process, and oftentimes someone that's hearing this, or even both of us as we leave the podcast today, we'll have
Mhm.
one of these thoughts. We will push into the future something horrible. Oh, I forgot to do XYZ, and now this is going to happen. We're going to do it. It's part of our natural mental processes. But if you could practice noticing that just happened, that I just imagined something in the future that I
Mhm.
didn't want. If you can just stop there, avoid saying don't think about that, because it's just going to go in a circle again.
Yeah.
Just stop and just acknowledge, okay, it just happened. And then ask the question, what do I want instead? So my significant other or our loved one is late and you're worried about them. So
Mhm.
automatically some horrible picture appears in your head because you're human and you're scared and you love this person a lot.
Mhm.
If you notice it happening in your mind, mental hygiene would suggest stop. That's obviously what I don't want. Okay, we've acknowledged that. What do I want instead? And make that mental picture of them coming home, giving you a hug, everyone's safe and sound. And that will take you to a much, much more realistic place.
Okay.
My personal opinion is that people that are, for lack of a better term, really good at anxiety have run that script the other way so much. It's
Mhm.
literally like reps. If you're shooting free throws, if you
Mhm.
shoot
Mhm.
a billion free throws, you're going to be good at free throws. So if
Yeah.
you run that anxiety script a lot, it's going to be the default.
Mhm.
So when you start practicing those things, the acknowledging that you're doing it is kind of that principle we were talking about. We looked at it and we said, oh, there it is. I'm doing it. Now
Mhm.
you got a handle. You can say, stop. That's what I don't want. What do I want instead? Um, an older way from kind of like the alchemy sort of world, they would say a phrase of, if you're in a room with a snake and a pot of gold or a treasure chest of gold, and
Mhm.
you keep your face on the snake, you'll never see the gold.
Makes sense. Yeah.
It's an old way of saying that, but it's very similar. If you're focused on the problems that are going on in life, you may have beautiful things around you you're not even noticing. Looking at the snake doesn't mean that it's not going to get you.
Mhm. Mhm.
So you can kind of keep your eye. So the way we work through these things is start acknowledging these sort of symptoms that people have, particularly right before they become physical. So if your
Okay.
symptom of your anxiety or an anxiety attack become your heartbeat elevating, well,
Mhm.
something happened before that. And if
Okay.
you can slowly start watching what happened right before, was it a thought? Did I make a picture? Am
Mhm.
I thinking about something that I didn't want? Now, if that's the case, what do I want and how does that affect these symptoms? All of the all of the quickest ways to make changes in your state, especially your physical state, are all based on breathing. So you can't get through a discussion of anxiety without having some discussion of proper breathing.
Okay.
And I think from sitting long periods of time and lessened exertion in our world today, I think we don't breathe very well. I find that education on breathing and stuff is very lax. But that's often the thing where we lose what people would consider control with a panic attack. Once breathing, which is something that both you do without thinking and you can do, by choice. Once you lose that and you get in some sort of struggle with your own breath, it's very difficult to come back from easy, especially in one step. So finding those earlier steps, like if the physical aspect of a panic attack or having anxiety is occurring, that's probably step 3 or 4, at least in a process. But oftentimes step 1, 2, and possibly 3, we don't even notice them. We only notice whenever we get to there. So that's where cognitive behavioral kind of therapies can bring you earlier and earlier into understanding the situation.
What's been your experience working with patients with this?
So this is actually direct interventional information that I use with patients on a day-to-day basis. What we'll do is I will ask them specifically to get to the very beginning of the situation and then even guess what happened before and prepare them for the next time it occurs. Even saying things like, when you leave the door or you leave out of the clinic, say you leave out of the clinic and you go for your keys and they're not in the right pocket. What is the first thing that's going to happen? You're going to be, oh, I left my keys. Oh, goodness. That's a good opportunity. Did you make a picture of that? If that were to go farther and farther, would it turn into anxiety? And so we kind of use this. It's a lot of education on what we call mental hygiene. Believe it or not, you are constantly making pictures, thoughts, having feelings. All of those things are going on in the mind at most times. It's often a very strong issue that's related to insomnia, I find as well, is finding these really rich, sometimes untoward pictures and mental images in your mind that you feel like might help you or protect you or prepare you for the future. But man, they just rev you up, like you said. And being revved up all the time is probably a way to get older faster. And that's not anything anybody wants.
Yeah. So in the example you just gave, so a patient leaves your office, they can't find their keys. So when you tell them to make a mental picture, what would you want them to picture?
What I would do is I would educate them on trying to stop as quickly as possible. Mentally make a stop sign, a stop, and say, you know what just happened? I just saw myself not being able to have my car, and I made a picture of myself super sad because I don't have my car keys, and now everyone's going to be embarrassed and all that. So before it goes that direction, just hit a stop and say, that's what I don't want. What do I want instead? So you change the mental picture to something that you're actually looking for. So my keys may be in my other pocket, and there they are. And now we've solved.
Gotcha. Or maybe you picture I'm in my car driving. Is that
absolutely? You're in your car driving. What you want to do is you just want to take that sort of run-on sentence that's not going to go toward your benefit and may end up physically having some effect, and you turn it into something that's either, innocuous or for your benefit. And I think sometimes when we have these conversations, people think, oh, this is just positive thinking. I think it's very specific. I think the more important part is noticing the bad thinking, because oftentimes people don't even realize that they're doing this. The example that continues to come back that kind of people relate to is that mother or father sitting in the chair. It's 10:05. Their teenager said they were going to be home at 10. What are those pictures, literally images in their mind? Most people, if they were honest, would say they were horrible pictures.
Oh yeah, sure.
And that in itself is quite bad mental hygiene.
Mhm.
When we go into things like marketing and different things, there's plenty of things that are designed to put pictures in your head. So you want a product or something like that. That's what marketing is there for. And the reason why it works is because we're so good at it.
Mhm.
But most of the people that are dealing, especially younger people that are dealing with anxiety, they really don't realize that they're doing it.
Of
The mental
course.
images and stuff are there. They just don't have any
Yeah.
understanding of it. And you know, if I were to make one health recommendation for the majority of the world, or especially the first world, it would be watch out, take care of your eyes. What's coming into your eyes has a
Mhm.
huge effect on everything that you do, and especially those things that are happening within the hour before you go to bed. Um,
Okay.
Having a screen or scrolling through a TikTok or something, ooh, it feels like you may have control over that, but you really don't. And
I totally agree. Yeah. I mean,
those things before you go to bed can be disastrous.
yeah. And I know what you mean. I try to get away from blue light
Yeah,
before bed. I often don't succeed, but yeah, and that's a whole nother topic, I guess. But I'm sure you probably know a lot about how I know the social media algorithms and the little reward system of likes just causes you to keep scrolling. It's really, I think it's a bad thing.
I one of my fun sort of examples to tell um, kids that are in that 15 to 22 sort of ages, I want you to figure out how are these companies making money? What is their product? And it normally, like, it seems a little more obvious for us as we're older, but whenever you open up to them that the product is your attention, then they're
Mhm.
like, oh goodness. You get
It's
all the
really amazing. I've listened to some podcasts with people who know how it works. It's amazing. In fact, I did read once that they take the social media companies take a lot of what casinos do.
absolutely.
The little rewards. It's almost like the old reward system they used to do for mice. In those
Oh, just
behavior modification studies.
yep. So when we get down to it, it's incredibly basic. We're pretty easy to read whenever our attention is gathered.
Hmm.
So
Hmm.
it's all about gathering that attention. So integrative medicine probably is working to get on the forefront of having a doctor-patient interaction so that
Hmm.
we're together and we've got attention. We're not distracted. The doctor and the patient is attending. And I
Hmm.
think whenever we have things like anxiety, I feel incredibly well prepared to handle those things because
Hmm.
we're going to be in the present moment where, as we've discussed, you can't have anxiety in the present. You can
Interesting.
you can
That's interesting. You mentioned the
only
present.
push it toward the
Right.
future. So be
Right.
here, be right now. It's you and me. Let's
Hmm.
breathe and let's talk about what's happening instead of just calling it anxiety and then letting that be that. Because it's almost like it's that little monster when it's a word anxiety that we both know but neither one of us can see. It can be anything. It can
Right.
be, 100-foot tall building. But whenever we start saying, actually, it's me thinking about something horrible in the future that I don't want, and I'm doing it so much that now I'm worried it's actually going to happen, so my heart's beating fast. Even saying that like a robot is going to bring down anxiety, because then you actually have an ability to handle it. So you
And,
stop.
go ahead. Go ahead.
So you stop. That's
Hmm.
acknowledge it. That's what I don't want. What do I
Hmm.
want instead?
What you just said a minute ago about being in the present is really interesting because I know people with meditation, and you hear that so often these days. You got to be in the present. It's really fairly difficult to do. I mean,
Yes.
unless you're in the middle of a task that's really got your attention. And I think that maybe that's because so many of us are spend an awful lot of our time not in the present, whether we're in the past thinking about things, gosh, I wish I'd done this, I wish I'd done that, or the future, you know?
Right.
And I wonder if that's one reason we love things like sports or movies, TV shows, because they force us to be in the present. If you're watching a football game, you're not really thinking about what you did yesterday or last month or the future. You're really into the game. And I'm sure there's a lot of reasons we love that, but anything that
That's
keeps the present probably makes us feel better.
absolutely. And it's well documented in a couple of books, the best of which is called Flow.
Okay.
by Mihaly Csikszentmihalyi is it's a flow state where you don't really realize that there is a present or a future or a past. You just keep going through it. And it's the same thing you see, like if you play music and it's just going and you feel like you're not doing it. Or in that topic, that book talks about these professional rock climbers. And when they're actually finding, it's as if they're doing it without thought.
And they would really have to be in the moment. I mean, you cannot, right? Yeah.
Yeah, we've
I
shown
totally understand the music. I play guitar, and you're right, man. You can. In fact, I'm sure. I think. Do you play an instrument somehow?
Yeah.
I thought you did. Yeah. But you know what I mean. There have been times I've sit down and play guitar, and I look up and it's been 2 hours, and
Absolutely.
seem like nothing. So that's a wonderful place to be in mentally.
So it's that flow state, but I feel like entertainment is kind of a replacement for that. It works just as well. You can zone out and do those things.
Right.
But meditation itself has a natural predisposition to get you into a present moment by observing what's going on as it's happening. And I think it's worth noting, there's a couple of quotes from the Dalai Lama that I thought were interesting in a present day form of meditation. So we kind of have a tendency to romanticize meditation as if it's this blanking out of your mind and your mind has nothing. But if your mind has nothing, you're done. You're out of here. The mind doesn't shut off. And if you want it to shut off, it may not shut on very easily. But what he described was every time when you come back to the present via meditation or via any sort of those refocusing, it's like doing a rep in the gym. He said, so it's not about staying in this moment. It's about noticing. Here's an interesting sort of connection. It's about noticing what's happening and coming back to that moment. So if you do that 100 times, the world would say you must be horrible because you can't even stay in the present. But the truth is, every time you break away and come back, you're actually doing a rep. The strength in finding presence is coming to the presence just as much as being in the presence.
Because I've tried to meditate and I have such a hard time because I do. My mind wanders, so I didn't realize that that's
so
okay.
So you're actually amazing at it. You didn't know. You didn't know you're really good. So I think it comes back to us. So in an emotional way, a lot of the Stoics talked about this equanimity or the equal mind being level-headed. Wherein if you have an emotion, say someone cuts in front of you in traffic or something like that, it's okay to be angry, but how quickly can you get back to zero? Be angry, but don't be angry for the next hour, 2 hours, 3 days, whatever. Get back to zero. And that's that same thing of acknowledging. So have the emotion, even be anxious, acknowledge that you did it. Kind of give a little bit of thought, say, stop. Okay, what do I really want next? Make that image and see if it just changes your trajectory.
Hey, for myself and everybody that's watching this, what are some good books on the Stoics that you'd recommend?
So the Enchiridion,
Stoicism.
On Stoicism, there's a lot of modern books that have come out. I wish I had the names and stuff available, but we can have those as links for later.
Yeah, that'd be great. We'll put the links up. That'd be great.
The Enchiridion is a great book.
Okay.
Modern Stoicism is a classic. There's a couple ones.
I'll put you on the spot without you getting a chance to look at it. You can always later just email me, and we'll put them as
There's
links.
There's one I'm going to put on there, but I think it's it's kind of like the modern Stoic as a pilot, or being a pilot in the modern Stoic. But I'll make sure and have those on there. The old classic books are anything by Epictetus, Marcus Aurelius, those guys. They really did a great job. The Enchiridion is kind of called the handbook of Stoicism. But it's a beautiful sort of topic. They were very, very compassionate, but just slightly detached. So, it's okay to struggle. It actually makes you stronger. So let's struggle, bring it on, that sort of thing. And I think it does apply. So we live in a world that is anxious because we are thinking about what the future holds. Remember, we have to craft the future we want instead of crafting the future that we hope does not occur.
Okay.
I think that's just some good mental hygiene.
Well, and to sum it up, can you sum up essentially your practice or your uh, I don't know. I guess maybe your prescription for dealing with anxiety.
If I were to sum it up so that the people listening here take something from it that they can apply, it would
Okay.
be that definition. Anxiety, understand the knowledge behind this.
Mhm.
Anxiety is imagining something in the future
Mhm.
that you don't want and acting like it's occurring right now. If
Mhm.
we know that, we can handle anxiety. It doesn't mean we won't have it, but it means we will not suffer from it. And that, I feel like, is the big change in the world. Anxiety is going to be natural, but suffering from anxiety does not have to occur. Find some people that are trained in integrative medicine, some cutting edge psychologists with cognitive behavioral therapy, and let's start talking about what it is instead of ruminating over the suffering that it's causing. That way we can do some things about it. And if all else fails, stop. That's what you don't want, acknowledge it,
Mhm.
and ask yourself, what do you want instead?
Okay. Okay. Sounds great. Well, thanks a lot for your time. I mean, it was a really interesting topic, and hopefully we'll help some people who are dealing with this sort of thing, and at least give some people some things to think about.
Wonderful. And thank you guys too. We appreciate you. Thank you, Birmingham, for being the wonderful city that you are. And all of us up here in Decatur appreciate everything that goes on down there at the Birmingham Medical News.
Well, thanks a lot. All right. Well, I guess we'll sign off, say goodbye to everybody, and hope you have a great night.
Excellent. Same to you, friend.